Isn't it frustrating not knowing why my IUI failed? Isn't it very heartbreaking not to know what to do after a failed IVF? All these disappointments and frustrations are arising because we don't know the basics. So I am also disappointed to know many couples after 8 years, 10 years of taking fertility treatment, they will sit in front of me not knowing what is endometriosis, what to do next. This is all because we lack the foundation. We don't know the basics about fertility. So here I'm trying to give you a best possible understanding of basics of fertility, how conception happens, and how doctors think when you are sitting in front of them. I am Dr. Sowmya Dinesh, fertility and cell therapy specialist, Santasa Fertility. So let me explain to you how I normally sit and explain my infertile couples so that you have a very sound understanding of what's happening to you. To conceive, we need 4 important factors. Let me explain. So we have uterus and endometrial lining. This is the lining of the uterus, which normally gets shed during menstruation. And uterus will have 2 tubes, and the tubes will have something like finger, almost like a hand at the tip. So, and there will be 2 ovaries, and ovaries will have follicles, and the follicle day 2, if it is of this size, day 10, day 14, and then it ruptures, releasing 1 egg. Normally, we can't see the egg. The doctor would be saying, oh, okay, your egg is growing well. That is a myth. It is not an egg. It is the follicle that we can see on ultrasound. We can never see egg on ultrasound. So this egg which gets released, that will be picked up, literally picked up by the fingers of the fallopian tube. That we call it as fimbria. So the egg comes here. So this is vagina where we have intercourse. And when we have intercourse, sperms will be released. Semen will be released here. So semen will have lot of tiny, fast-moving fish-like cells that are called sperms. And the sperms will have something, very amazing. They will have head, neck, and tail. They will be swimming fast like tadpoles in water. So they will all be moving up. They come all the way after intercourse, it takes almost 1 day for them to reach here. And then we will have an embryo. Let me mark the embryo with the green color. So here embryo is there. So once the embryo is formed inside the fallopian tube, it takes almost 5 days for the embryo to travel all the way up into the endometrial cavity. So once the embryo reaches the endometrial cavity, the endometrium, it takes it in. It takes it in and the embryo starts growing for 9 months, and then at the end of it, we will have a beautiful baby. So if these 4 factors, what are they? 1, good sperm, beautiful endometrium and normal uterus, and ovary with nice eggs, and a patent working tube. If 4 factors are working well, then the couple will conceive. Like if 4 factors are okay, so the couple in 1 year, most of them will have 1 pregnancy. This is the mathematics. Like if all these factors are working well, then we will have 1 pregnancy at the end of 1 year. So when the fertility specialist is trying to evaluate to find out why you have been infertile so long, they are going to mainly assess these 4 factors. So they will order a semen analysis. They will do an ultrasound, pelvic ultrasound, to look at the uterus and the lining of the uterus, if it is okay, or if there are some polyps, some fibroids or anything. They will look at ovaries for the number of follicles, whether you have PCOS, all that will be detected by ultrasound. After this, to look at the tubes, we have to do a special test called HSG, or a hysterosalpingogram, which is an X-ray, so that we push a dye from here. So the dye goes all the way up and it will delineate the tube. And when it comes out, we know that tubes are open. Apart from assessing these 4 factors, we also need blood tests to assess your general health. So now I will explain. After, you do this test, you go back to the doctor and say, hello doctor, here are my reports. And now what does the doctor think? How do they plan treatment for you? I'm going to simplify it and explain to you so that you understand fertility management is not like moving from scan to scan, test to test. You should becomes positive. What are they going to do? You should have a basic information of their plan already in your mind. So you got the test, and if scan is okay, that is scan is okay, semen test is reasonably okay, and blood tests are showing that you guys are healthy, and your tube test is also okay. So then what the doctor plans for you would be ovulation induction plus timed intercourse. That means they will give you medicine to produce eggs, and they will follow the follicle size, and then once it is right size, they will give you a trigger injection for the ovulation to happen. During that time, they will advise, okay fine, this is the time for you guys to have intercourse, and they will help you to have intercourse during the maximum potential period. So this is called ovulation induction plus timed intercourse. So they will try 1 to 3 times. If you conceive, amazing. So then we will start a different journey. In case there is no pregnancy at the end of 3 attempts of ovulation induction, then we will move towards ovulation induction plus IUI. What is IUI? IUI is a very simple procedure. Normally, when we have intercourse, this is the uterus and this is the vagina. These are the tubes that I already discussed. So semen will be deposited here, and along with the semen, we will have dead cells, debris, and a lot of other things. There would be pus cells, the slow-moving sperms, non-moving sperms, all of them would be deposited here in the vagina. So we take the semen in the lab, we process it so that all the fast-moving smart ones are processed, and they would be put back here. So that we will help this much of journey for the sperms. So all those fast-moving sperms would be placed here. The processed semen will be processed here. So sperms will come and move, and you will have increased pregnancy chances. So the doctor would plan this for 1 to 3 times. If you conceive, again amazing. If you are not conceived yet, till now you have not achieved a pregnancy, then it's a matter of concern, because we did a scan, we did blood test, we did semen analysis, we did tubal test which is an HSG X-ray, and we couldn't identify much, but we were trying and hoping that you would conceive at this point. But you have not conceived it, so now we are in a dilemma what to do, because we can't trust the information that has been given to us till now. Maybe we would need higher tests. What are those higher tests? Normally at this point, laparoscopy and hysteroscopy will come into picture. We call it as diagnostic hysterolaparoscopy. DHL because diagnostic, because we are trying to see what else might have gone wrong, because all the problems can't be picked up on scan. If tubes are stuck inside, we can't see. If there is a small polyp inside the uterine cavity, we can't see sometimes. So we would do diagnostic hystero. We will look inside the uterine cavity and we will look inside the tummy, both. So we will do this, and in case if things are okay, or like if there's some adhesion, stickiness, we will release it. If you have PCOS at this point, we may consider doing ovarian drilling, and then we will again plan for IUI, ovulation induction plus IUI. We might consider again 1 to 3 times. See, in case if we find some major problem which we didn't know earlier that we thought everything is okay on scan, everything okay on HSG, but we didn't know there was something more serious inside. We found that the tubes are not healthy and there is some major problem inside the tummy. Then we will consider IVF at this point. So in this category, after 3 cycles, then we will not wait further. We will tell you honestly that, see, we tried all the basic ones. We tried IUI, then we tried lab, then we tried IUI again, but still you are not conceived. So we don't know whether your eggs are okay and your sperms are actually reaching the eggs. Egg and sperm should become embryo. We don't know whether embryo is forming and not getting implanted, or we don't know whether you are making embryo at all. So at this point, we will advise you IVF. Because in IVF, we will take your eggs out of the body, we will take the sperms out of the body, and we will mix them together to make embryos. And we will know if sperms are fertilizing the eggs and embryos are actually forming or not. And if embryos are forming, we will know the quality of the embryos. and then we will transfer those embryos back into the uterus. So this is how we go. At this point, we might come here again if there are major problems in laparoscopy. This is the actual plan. A fertility specialist should make you understand before they even start this particular step. So here, let us come to what are the pregnancy chances in each method that we are trying. So here, probably if 10 couple are trying, maybe one of them will conceive every month. Again, in IUI, probably again out of 10, one might be conceiving, maybe 10% to 15% if they are young. So then in IVF, we would expect 40 to 60% depending on the age group. If they are within probably 35 years, we would expect this figure. So we will next go to IVF. We will see how many embryos are formed. In case if we have maybe around 6 to 7 embryos, in the first cycle of transfer, that is called embryo transfer, ET. First ET, we will place 1 or 2 embryos depending on your health and the embryo quality, and approximately 40 to 50% will conceive with first IVF transfer, embryo transfer. What about the others? Another 60%, what happens to them? They wouldn't conceive at the first attempt. So in case if they don't conceive with the first attempt, then we will go back, we will look at other embryos that they have, then again we will start putting them. So this will be second transfer at embryo transfer. So with this 1 to 3 embryo transfer cycles, approximately we would have 80 to 85% of them conceived. So this is how we should plan our journey through IVF as well. What about the remaining 15 to 20%? What happens to them? So as you all understand, as many of the couples think, IVF is not the last step. IVF is one of the simplest procedures that we perform in a IVF clinic. Generally, for all in vitro fertilization techniques, lot of them are there, maybe like 7 to 8 of them are there. For all of them, generally we couple to understand, we generally term them as IVF. But there are other procedures, advanced procedures. After IVF, we have ICSI, then we have PICSI, then we have laser-assisted hatching, then we have embryo biopsy. This percentage of people might require advanced IVF technologies. So we are in an era where a lot of advances have happened in the field of fertility management. So most of the problems that couples face would be salvageable, manageable. So don't lose hope. Be positive. Always keep an open mind and sit with a consultant. And in case if you have some queries, please, make a note of them when you go for consultation. So understand this process so that you will have a clear roadmap for your fertility journey, and let it be a very beautiful, successful one. All the best.